Thank you. It's a great pleasure to be here in this beautiful part of Turkey. I've not been to this area before, and I'm very impressed by how beautiful it is. So I'd like to talk to you about dopamine and psychosis, and really give you some of the latest findings from my group and others around the world. And this symposium was organised in collaboration with the British Association of Psychopharmacology, which is very pleased to work with you on this symposium and some others at the meeting. And if you still have a good thirst for psychopharmacology, and I hope you will after this session, we have our summer meeting in July this year in Cambridge. And I've heard that Antalya is very hot in July. Cambridge will be much cooler, but still should be nice and sunny. And again, it's a very beautiful place. So if you are interested in more psychopharmacology, do come to that meeting as well. It's a very good meeting. So I'd like to thank the very many people who've helped with the work that I'm going to show you today. But I want to move on quickly now to talk about dopamine and where we come from. The idea that dopamine is involved in schizophrenia is something that's been around for a long time. In fact, it's been around at least from the 1970s, when Meltzer and Stahl wrote this review, The Dopamine Hypothesis of Schizophrenia. But it's worth remembering that it really wasn't until the 1960s that people first recognized that dopamine was a neurotransmitter in its own right. Before that, people thought it was just part of the synthesis pathway to noradrenaline. But actually, it's in the 1960s that people recognized it was a neurotransmitter in its own right. And by the 1970s, our understanding of the role of dopamine in the brain was still quite limited, and our understanding of what was going on in schizophrenia in terms of dopamine was even more limited. So this was a very influential hypothesis, but it has changed a huge amount since then. I think of it a little bit like the Rolling Stones. Here's a picture of the Rolling Stones in the 1970s, when they were at the peak of their fame. I think of it a bit like the Rolling Stones because, like the Rolling Stones, the dopamine hypothesis has been around for a long time, and it just doesn't go away. It keeps coming back. The Rolling Stones are always going back to give concerts and tours, making a huge amount of money. I'm sure they come to Turkey, they go on these world tours every few years. They can't get rid of them. I think there is a big difference, though, with the Rolling Stones and the dopamine hypothesis, and that is that I like the Rolling Stones, but essentially what you hear at all their concerts these days is still the same songs from the 1970s, whereas the dopamine hypothesis has got some new songs, and better songs, I think, but I will let you judge that. So there you have it. The dopamine hypothesis is like the Rolling Stones. But what I'm going to talk to you about is what we didn't know in the 1970s. What we really didn't have any idea about is what aspect of dopamine was abnormal. Because all we had then was indirect evidence, and we had very little idea about how it would be linked to symptoms. So in terms of what aspect of dopamine is abnormal, this is a cartoon picture of the dopamine of a synapse, the dopamine synapse. Here you see the presynaptic terminal with the dopamine ready for release. It gets released, crosses over and binds to the receptors postsynaptically, and you get the signal being transduced. A lot of focus in the 1970s and 80s was on this end of the dopamine system, on receptors. Because, of course, that's where all our antipsychotics act, and still act. But it has become clear that there is no abnormality here, and there is no abnormality here in the transporter. These two areas of the dopamine system, when you look in vivo in drug-naive patients, don't show any alteration, or any marked alteration compared to you or me. Where we clearly have evidence of abnormality is here, in that synthesis and release of dopamine in this presynaptic side of the system. And I will show you the meta-analysis that shows that. So here are all the PET and SPECT studies of this presynaptic side of the dopamine system with their effect sizes. Anything over this side of the graph means that it's elevated in schizophrenia. Anything over this side controls. And you can see that all the studies pretty much lie over here. And the overall effect size is large, highly significant. So there is a large, highly significant elevation in this synthesis and release of dopamine. So that is the first message for today. We have a new song compared to the 1970s about dopamine because now we know where the locus, where the place of the major abnormality of the dopamine system is in our patients. It's presynaptic, it's not receptors, it's not the transporter. So that's telling us about people who've already got schizophrenia and a psychotic disorder. But of course that doesn't tell us whether this has led to that illness. To understand that, we have to study people with a prodrome to the illness. And we know that at least 75% of people with schizophrenia show a clear prodromal phase, gradually increasing impairments and symptoms. And that allows us to study these people before they develop the illness and then follow them up. And that's something that we've done in the last few years, and other groups have begun to do as well. And we measured presynaptic dopamine synthesis in people who showed early indicators of being in the prodrome to schizophrenia, to really test whether dopamine might be driving this development of psychosis. And here are the data. So, on the vertical axis, you see the level of dopamine synthesis capacity, highest at the top. This is a PET measure. It relates to the absolute amount of dopamine that's being made in the brain. With PET, you have quantification because you are labeling molecules and you are tracing the fate of those molecules in the scanner. So this isn't a relative amount of contrast like an fMRI experiment. This is a quantification. And here you see the level of dopamine synthesis in controls, in you or I. We all need some dopamine, of course, in our brains. Here you see it in people in the prodrome, and you see that it's already elevated, but not quite as much as you see in people with established schizophrenia. So, this really was the first evidence that there was a dopamine abnormality in the brain of people prior to the onset of schizophrenia. Here it is visually. Let me just orient you. These are images through the brain. This is an average image across all the prodromal subjects. 30 subjects in this first cohort, showing areas where there's elevated dopamine. This is where the nose would be, front of the head. This is where the ears are. This is looking from the front, slice through it, and this is from the top. So this is where the ears would be. So hopefully you're oriented now. And here you see in yellow and orange the areas of significant elevation. And this is in the striatum, this region. And you can see that there are significant elevations in the striatum, throughout the striatum, in the prodromal people before they developed that illness, schizophrenia. And what's more, the greater the degree of elevation, shown on the horizontal axis here, the greater the degree of symptoms shown on the vertical axis here. So there's a correlation between the more severe symptoms, the higher the dopamine synthesis capacity. So these two things are related, even in the prodrome. We've now replicated that finding. This is our second cohort of people in the prodromal phase, and here again you see the same elevation. Large effect size, very similar effect size in fact to what we see in the first cohort, already elevated before the onset of illness. So that's very interesting. This is my second message to you. We now know that dopamine is abnormal in the brains of people even before they develop schizophrenia, when they are showing prodromal signs and they might go on to develop it. That is a clear change to what we knew in the 70s and the 80s and the 90s. What's more, we followed up these people to see what happens to them. So again, vertical axis, you see that level of dopamine synthesis capacity highest at the top. Controls, people who show those at-risk features that don't go on to develop schizophrenia in blue, and those that go on to develop schizophrenia in red. So the elevation is specific to people that go on to develop schizophrenia. So again, not only is it elevated, linked to the severity of prodromal symptoms, but it's also specific to the development of the illness in the next year or so afterwards. We followed these people up now for about 4 years. So we think that these people in blue are fairly unlikely to develop schizophrenia now. But nevertheless, we need to follow them up further because it's still possible that they might develop it down the line. What's more, when you rescan those people in the prodrome who go on to develop schizophrenia, you see a change in their dopamine system as they develop schizophrenia. So let me show you those data. Again, this is the vertical axis showing the dopamine synthesis capacity. This is the scan in the prodrome, the baseline scan. So remember, this is already elevated compared to you or I. But if you rescan them after they develop their first psychotic episode, before they have any treatment, you see that there is a further elevation with the onset of psychosis. So it seems to be that dopamine is elevated and is dynamically increasing further as they develop the illness. This was true in 7 out of the 8 people that we were able to rescan. You can imagine it's quite hard to rescan people who are acutely psychotic. We rescanned, of course, those people that didn't go on to develop psychosis after a couple of years. They show no change in their dopamine system. You only see this change in the people that go on to develop psychosis. Just to summarise for you what I've shown you, these data give us in vivo evidence for dopamine dysfunction, presynaptic dysfunction consistently in schizophrenia, now also in the development of schizophrenia, shows that the major locus, the major place for the dopamine abnormality is presynaptic, and it's linked to the onset of psychosis. You may well be asking, schizophrenia is not just psychosis. What about cognition and negative symptoms? So in the last part of my talk, I'm going to share with you the data we have on that. Firstly, cognition in schizophrenia. Well, it's clearly impaired. This is taken from a review which shows the level of cognitive impairment in people with first episode. Let's try that again. People in the first episode, relative to controls, the healthy people who are 0. This is you or I, this is the average cognitive function in the healthy population. You can see that people in their first episode, this line at the bottom, already show quite marked impairments relative to controls. But also, the people with these prodromal symptoms show impairments even before the onset of schizophrenia, this line here. So clearly cognition is impaired even before the onset of the illness. So the big question is what underlies the development of this cognitive impairment, and probably negative symptoms as well in schizophrenia. And we tested this. First of all, we wanted to see whether they were two independent processes driving the development of these domains of symptoms. So it could be that cortical dysfunction is linked to the cognitive impairments and negative symptoms you see in schizophrenia, whereas the striatal dopamine dysfunction that I've just shown you is specifically linked to psychosis. Or it could be that there's one common factor that is linked to both these two aspects of the illness. This is what we set out to test. And the first evidence that we've got that they might actually be linked is from a measure of cognition, the verbal fluency task here. And this is a very simple task that you may well have used yourself, where you ask patients to think of as many words in a given category in a minute. So you might ask them to think of as many words beginning with a letter F in a minute, or as many animals. And this is a measure of frontal executive function to some degree. And of course, the more words you think of, the better your performance. The highest performance is up here. People in the schizophrenia and in the prodrome are impaired on this task. And here you see that in the prodrome, the greater the level of impairment, so the fewer words they can think of, is associated with greater dopamine synthesis capacity. The more severe their dopamine dysfunction, the more severe their cognitive alterations, even in the prodrome. So this is the first piece of evidence that these two things might be linked. But we wanted to look at the cortical dysfunction that we think is underlying the cognitive and negative symptoms of schizophrenia. So we used a version of this task in the fMRI scanner. And basically, in the scanner, the patient is lying there, speaking into a microphone, and they're presented with a series of stimuli, for example, letters, and they're asked to think of the words beginning with those letters, just as in the bedside version of this task. So if you saw the letter S, you were in the scanner, you'd have to think of a word beginning with the letter S, and you might think of a word like stop. Hopefully that's not what you're thinking about me at this moment, but that would be a perfectly valid word. And you say that into the microphone so we can check that you've got it right. And we scan people during this to look at their cortical activity. And here it is. In the prodrome, there is already dysfunction, cortical dysfunction. And here you see the areas in the frontal cortex. So again, this is where the nose is, ears on either side, and looking down on the top. And you can see that there is this altered activation. And it's the same pattern of altered activation that you see in schizophrenia, just not quite as marked. It's already there, even before they developed frank schizophrenia. So that's, I've shown you the verbal fluency task is associated with increased activation in this frontal area in the brain. But what's much more exciting is when you look at the relationship between the degree of severity of this alteration in the frontal cortex and dopamine synthesis capacity. And you see that they're closely related. The more elevated the dopamine, the more altered is their frontal cortical function. So these really are the first data showing that in an at-risk state, there is already a link between the cortical and the subcortical systems. So just to summarize, striatal dopamine reliably altered in schizophrenia, it's presynaptic, frontal cortical dysfunction reliably altered in schizophrenia, and there is that evidence that we have and others have. I'll have to come back if you want to hear that and tell you that another time. There's evidence that they are both related, but you also see the same pattern in people with prodromal signs of the illness. All related, even before the onset of the illness. So So in terms of these two alterations, these two possibilities, well, it seems unlikely that they are completely independent processes. It seems, given that they're so closely related, that there must be...
Sizleri saygıyla selamlıyoruz efendim. Bugün oturumumuz Imaging of Dopamine in the Living Human Brain başlığını taşıyor ve birbirinden değerli konuşmacılarımız var. Ve bu oturumu çok değerli dostum Doktor Samet Köse ile yöneteceğiz. Kendisi tıp fakültesinden bir abim olur. Bir dönem üstteydi benden. Oradan gelen bir dostluğumuz var Serhat'la birlikte. Ve Kazım abi de hepimizin abisiydi o zaman. Asistan da kendisi. Evet, ilk konuşmacımız Doktor Oliver House. Bu çok değerli araştırmacıyı size kısaca tanıtmak istiyorum. Doktor House İngiltere'den geliyor ve kendisi Royal College of Psychiatry üyesi, psikiyatrist. Londra Psikiyatri Enstitüsü'nde ve MRC CSC Imperial College'da grup başkanı olarak çalışıyor. Ayrıca klinik çalışmalarını Mosley Hastanesi'nde danışman psikiyatrist olarak yürütmekte. Grubu önemli ruhsal hastalıkların nörobiyolojisini ve tedavi yanıtını incelemekte. Bu alanlarda çok değerli ve çok gerçekten olağanüstü çalışmaları var grubun. Son 4 yıl içinde ISI Thompson bu grubun 12 tane çalışmasını en iyi top %1 arasında değerlendirdi. Ayrıca Faculty 1000 bu grubun yine 9 makalesini olağanüstü olarak nitelendirdi. Hem 2009'da hem 2010'da Science Watch bu grubun yayınladığı makaleleri o yıl aldığı sitasyonlara göre yaptığı değerlendirmeleri en iyi 6 arasında sıraladı. Ayrıca araştırmaları çok çeşitli ödüller aldılar. Bunlar arasında Avrupa Psikiyatri Birliği Biyolojik Psikiyatri Ödülü
judge whether the dopamine hypothesis has aged better than the Rolling Stones. But just to help you, here's a picture of the Rolling Stones today. I'll let you be the judge of whether they have aged as well as the dopamine hypothesis. Thank you very much for your attention.